A 33-year-old man is involved in road traffic accident. He is initially stable and transferred to the accident emergency department. On arrival, he is catheterized. 1 minute later, patient become hypotensive. So just 1 minute later, patient hypotensive and evidence of the angioedema surrounding the penis. What is the most likely explanation of the event? That means in this question, a 33-year-old man undergone road traffic accident and attended in accident emergency department, and he was catheterized. But after 1 minute, just after 1 minute, patient become hypotensive and angioedema surrounding the penis. So what is the explanation? Is it type 4, type 5 latex hypersensitivity reaction, type 4 latex hypersensitivity reaction, type 3 latex hypersensitivity reaction, type 1 hypersensitivity reaction, and type 2 hypersensitivity reaction? Here we can see the sudden collapse and angioedema following exposure to latex or following exposure to any chemical substances suggest this is type 1 hypersensitivity reaction. So the immediate reaction, that means the immediate angioedema and sudden collapse, these are the feature of the type 1 hypersensitivity reaction, because type 1 hypersensitivity reaction is present very short time. Here you can see the different type of the hypersensitivity reaction. First of all, type 1. In case of the type 1 hypersensitivity reaction, it is IgE, immunoglobulin E mediated. It is immunoglobulin E mediated. So immunoglobulin A mediated, and it occurs within hours, and it causes the anaphylaxis. So in case of the type 1 hypersensitivity reaction, what occurs? The allergen, it binds with the IgE receptor, and finally what occurs? There is a release of the mast cell granules, and these granules are responsible for development of the clinical feature, which is the shock. In case of the type 2, also it is known as the cytotoxic. So, and it is done by the IgG and IgM, and it occurs within the hours and days. And it, what happens? It is cytotoxic, that means it kills the cell, it broken down the cell. Third one, which is the type 3. In case of the type 3, antigen and antibody, they form a complex and they travel through the blood vessel. So antigen and antibody, what can they do? They, so this is antigen and this is an antibody. So antigen antibody form a complex, and finally they circulate in the blood vessel and deposit in different part and different organ of the body, including the kidney, including the lungs, and producing different type of the clinical feature. And last of all, which is the type 4, it is the T cell mediated, and it requires longer time of the period. So what is our answer? It is the type 1, because it is very short term duration, which is it occurs within the 1 minute with contact with an allergen. So it is type 1 hypersensitivity reaction.